A temporary thrill, a momentary high, and possibly a lifetime of suffering when the situation gets out of hand. Addictions come with a heavy price. Many who have addiction problems suffer alone in silence. They are reluctant to ask for help because of shame, fear, or not knowing where to find help. Some are not even aware that help exists. Addictions can happen to anyone, and it could happen to someone close to you.
I've been drinking for more than 30 years, but it's only been in the last maybe 5 years that it's been becoming more and more of a serious problem. In recent years, I've noted that it has come to adversely affect my relationships with my family members and also to some extent my work situation.
My husband has this gambling problem for 15 years. One time, gamble away in one day my paycheck. I believe that in a marriage, the most important is the trust. And these 15 years, I feel that I'm betrayed. We are all hurt by our loved ones.
Addictions not only wreck the lives of those afflicted, but also affect their families and friends. The social stigma further prevents sufferers from reaching out for help. But there is hope for recovery.
Addiction is a chronic progressive illness in which people lose control over their activities in the course of their illness. Some people still mistakenly believe that it is caused by lack of willpower or your moral strength. It runs a similar chronic course as like any other medical illnesses like hypertension, diabetes, etc. Common addictions will be alcohol, drug use, and gambling addiction.
The Institute of Mental Health launched the Community Addictions Management Program in 2001 to treat behavioral and substance addictions. In 2008, the National Addictions Management Service, or NAMS, was set up to meet increasing demand for specialized treatment.
Addiction is a highly treatable disorder. With appropriate treatment, people can recover from their illness in the long run and achieve full sobriety from the particular form of addiction. Common forms of treatment would be using medications or psychotherapy.
NAMS offers inpatient and outpatient services. The Specialist Outpatient Clinic assesses and treats patients with addictive disorders. Patients consult doctors and counselors and undergo individual, group and family therapy.
All of our patients are admitted on voluntary basis. We provide for them medical and psychological support. All these patients need to attend preparatory sessions before admission, and this is to help them to set their goal, to manage their expectation and to prepare them mentally before admissions. The patient needs to go through what we call detoxification and rehabilitation program. During the detox phase, what we do is to place the patient in a safe and secure environment, and we help them to relieve their withdrawal symptoms. This is to stabilize their conditions and to maintain their current recovery. During the rehabilitations, the patient will be taught on how to manage their emotions. They will be learned on the techniques on relapse prevention, and we try to inculcate in them on a healthy lifestyle where they will learn through what we call a group therapy or psycho-education sessions. And all of our patients, when they are discharged, they will follow up with our clinics via the counselors as well as the doctors.
NAMS is committed to caring for the patient as a whole person and not just treating the disorder. Every patient will have a carefully customized treatment plan to overcome the addictions.
You have counselors in NAMS. They teach you in the classroom environment things about what is addiction. For one, I learned to accept that I was an addict.
NAMS consists of a multidisciplinary team of professionals, which include doctors who are psychiatrists, trained counselors, include nurses, research assistants, psychologists, and other allied help who come together to help the patient to overcome their issues. If you and your family need help on addictions and support, you can call our helpline, which is manned by our trained addiction counsellors.
NAMS conducts training for healthcare workers and voluntary welfare organizations on identifying and referring individuals with addictions. We also conduct forums and talks to the general public to provide accurate information about addictions and where to seek help.
Here at NAMS, we are the National Centre for Assessment and Treatment of a broad range of addictions. We not only provide treatment to people with addiction problems, we also reach out to their families.
Our patients can be assured of quality treatment under the care and support of our professional and caring team.
Clients sometimes believe that they are battling their addictions alone, but there are family, friends, recovery support groups, as well as NAMS professionals coming together to help the individual.
At NAMS, our patients know that they are not alone in overcoming their addictions. We are committed to providing professional, comprehensive, and customized treatment. But most importantly, we also want our patients to see all of us at NAMS as faces that care.